We're talking about symptoms of colic this evening. This person wants to know what are the well-known signs of colic versus the signs that are not so often seen. And this is a great question stemming from one of my most recent videos about what I would and would not do with my own horse after being a pro equine groom and equine vet tech. So here we go. First, I'm going to start with just a quick little overview of what colic is, which is just a term to broadly describe abdominal discomfort. It's also important to keep in mind that there are a variety of other issues that may present as a colic, but aren't actually a true colic at all. So starting off with some of the most obvious signs of colic would be them looking at or kicking at their belly, having a decreased appetite or not wanting to eat at all, pawing, rolling, or thrashing, an elevated respiratory rate, and or a decreased or absent fecal output. Another fun fact is that if your horse is still passing manure, they can still be colicking. Just because a horse is colicking, it doesn't always mean that they're impacted and that they're not going to pass manure. The more subtle symptoms of colic would include just plain old lethargy, that they just may be feeling a bit out of sorts, not really following their daily routine. Lip flipping is a big sign that often goes missed. This is also called the phlegm response, which allows horses to absorb smells in their surroundings a bit better. And lip flipping is often viewed as something that is cute or funny that a horse does, but it is also a pain response. So if they're flipping their lip completely out of the norm for them, then you might want to investigate it. One of the last subtle signs is an elevated heart rate. Unfortunately, not a whole lot of people know how to take their horse's heart rate or pulse. Therefore, an elevated heart rate can easily be missed. A horse's heart rate is a pretty good indicator of how much pain they're in. And if you don't know how to get your horse's heart rate or pulse, I highly recommend getting with your vet and having them teach you.